Okay, Dr. Kessler, here we are. Can you please introduce yourself?
Sure. My name is Dr. Lawrence Kessler. I'm a board-certified emergency physician for over 30 years. During those years, I've moved from the emergency room into the urgent care realm. And after all the years of fixing and repairing people, several years ago, we walked into the restorative wellness field and began our practice of wellness and optimization of health.
Excellent. Now, can you please dive right into the women's health?
Sure. So women's health is actually one of our primary concerns. The number one killer of women in this country and the world is not breast cancer, it's heart disease. And sadly, when women enter menopause, they lose the only protective chemical that the body naturally makes to prevent heart disease, estrogen. Now, over the years, estrogen has gotten some bad press. Due to several studies with synthetic hormones, the world of medicine has moved away from hormone therapy as a restorative medical practice. What we do here at Restoration Health 365 is we only use what's called bioidentical hormones. These are hormones that are made from plants, yams and soy, and then in the lab are made to be the identical replication of naturally occurring hormones. What's the difference? Well, our bodies were never intended to process synthetic chemicals. Synthetic chemicals are your commercially available hormones. We don't use them. We only provide what the body naturally identifies as a normal circulating hormone. And the reason we do this is if you think back to the healthiest time in your life, it's when you were young and healthy, when your hormones were raging. And that protection is what we want to offer our patients throughout their lives. It's not a matter of your lifespan. It's really a matter of your health span. Improving and increasing the years that you're healthy is far more important to us than just improving the length of your life or lengthening your lifespan. Because there's no benefit in living to 90 if you spend the last 35 years of your life in and out of the hospital and multiple doctors with surgeries and treatments and things that take away quality of life. In our practice, we're all about quality of life. And for women specifically who, for no reason of their own, have had the hormones taken away from them through bad information and misinformation. And we're here to provide the correct information that hormone restoration, restoring the body to its natural state through bioidentical hormone replacement, is the best way to do that.
And how do you differentiate your practice, the way you practice medicine, opposed to someone else, a different physician?
So we differentiate ourselves in that we understand that the process of medicine is dynamic. What was once rules in 1960s are no longer rules in 1980s and may have changed in 2000. And so we are not subject to what I call the confirmation bias that most physicians subscribe to. That is, what we were taught in med school is what we continue to preach to our patient. We've moved away from confirmation bias. We embrace the technology and we embrace the studies that support what we do. In our practice, we embrace the term or the phrase, normal is not optimal. You go to your doctor not feeling well at 50, maybe you gained a few pounds, you got a little tired, maybe your hair thinned, you're not getting to the gym, you're not eating as well, and perhaps the bedroom is not what it was. Your doctor runs some blood tests and you hear, your blood tests are normal, diet and exercise. That's not what we do here. What we do is look at those tests and understand that normal is not optimal. We get you back to what you were by restoring what you no longer make. It's a simple process. As we age, our circulating levels of hormones decline. That's part of the aging process. But it doesn't have to define your wellness. Restoring what you no longer have is the foundation of what we do.
Now, are these plans that you're going to develop customized for every individual?
Sure. So at the heart of what we do is precision medicine. and based on the individual needs of our patients. That's why we only use compounded medications. Now, a lot of people argue, oh, compounded medications, aren't those fringe, or where's the regulation? Is the FDA? The point is, when you go to your commercial pharmacy, you're getting a product that's made for the masses. Worldwide distribution. That's not you. What we do in precision medicine, an individual approach, is determine exactly what your needs are, not your neighbor's needs, which are most likely very different. And so we're able to customize treatment protocols based on your specific needs, which again are very individual. Our practice is not about the masses. It is about the individual and the individual needs. We don't want you to be a Cessna. We want you to be an F-15. And we get you there through prioritizing exactly what your body requires, and only your body.
Now, another question that came to mind is what to expect for a patient when they first walk in. What kind of labs and how long does the process of procedure take?
So that's a great question. When you come to Restoration Health 365, you're not going to find a typical medical office. First of all, there's no packed waiting room. As a matter of fact, there's no waiting room. We only schedule 1, 2, or 3 people a day because each person that comes in is an individual process that takes between 3 and 4 hours. The lab tests that we order are done 2 weeks prior to your consultation. That gives us time to get the results and go through the results using an AI-driven platform and our expertise to determine exactly what your blood tests show. And based on that, the second phase would be an exercise evaluation in which we look at your performance, your heart rate, or which we actually call it your horsepower. Through exercise evaluation, a nutritional evaluation, and your hormone evaluation, we're able to devise a plan solely based on what you need. Now that process is typically 3+ hours. And so you're not walking into a medical office with a packed waiting room. You're walking in for a one-on-one consultation with your physician, myself, or my partner, Dr. Flashner, who are experts now in the wellness field.
All right, we're going to dive right into male health.
So men's health, just as women enter menopause in midlife, men enter andropause. So what's andropause? What's menopause? Both occur when the reproductive organs no longer function at the highest level. And it's a gradual change. It doesn't happen one day to another. And so just like women experience symptoms over years, men may develop symptoms over time. Symptoms including loss of energy, fatigue, brain fog, loss of libido, loss of exercise tolerance. In some men, it goes as far as some depression and anxiety. All of these symptoms, when you end up at your regular doctor, you're going to end up with 5 different medications treating your symptoms because your doctor doesn't do what I do. We look at the root cause of disease. And the root cause of men's health, or andropause, the other terms you might have heard are the metabolic syndrome or syndrome X. Now, this is the men who gain a little weight around the belly, start to thin the hair out a little bit, and just generally have less interest in a healthy lifestyle. And it's not their fault. The bottom line is, just for men, we stop making the male hormone, which is testosterone. Now, testosterone over the years has gotten some bad press, but I can tell you honestly that bioidentical testosterone, I'm not talking anabolic synthetic steroids here, but testosterone is probably the single most important hormone for men and women. Both need it. Now, when I talk about men's health, the restoration of testosterone can come in many different forms. Today, it's available in many different applications specific to the patient needs. We tend to favor one over another because our patients do very well with it. But when we treat men, we often end up treating the women. And this is critically important. We'll talk about couples therapy, if you will. I have several couples who come to us for health restoration. And the reason why it's critical is, if I'm going to restore the man's health and his energy level is increased and his Lean muscle mass is getting better at the gym, and the brain fog is dissipated, and his libido increases. Now I've got a man walking around. And if his wife is not a party to the party, then she's walking around unable to meet him. And this is where the confluence of health comes together. Happy couples are happy because they're interactive. And when we treat one, we often treat the other, and we recommend the treatment. And when that happens, both people end up improving their vitality, their health, and their longevity, which is the crux of what we do here at Restoration Health.
Love it. Okay, so let's now talk a little bit about, I know you are a published author. I know that people can find your book on Amazon, and you have something up and coming in the works. Talk to us a little bit about your books.
Yes, thank you. So about 12 years ago, I wrote a book called We All Die Once. It's an intensive look at the medical history of where medicine came to at the point. Now, back in 2012, the political agenda and the issues were the Obamacare and the fight to prevent it or to install it. What we looked at in We All Die Once is the basic premise that as we age, no matter what our doctors do, in the end, we all die. But it's how well you live that is important, not the end, right? The journey is more important than the destination, and which dovetails into my second book, which will be released soon, entitled Ophthalmology, The Future of Medicine. And in this book, which is written for both practitioners and patients and scientists alike, we delve into both the medicine of hormone restoration, we delve into the political, the social, and the factual premise of how hormones have been restricted, why they're thought to be fringe therapy, the literature of how it got to be where it is, and how to move forward. In life, we often find that we learn something. And sometimes we need to unlearn what we learned to appreciate where we are today. This has been the basic hindrance of modern medicine. It's failure to unlearn what was previously thought to be correct. And in medicine, we often see the pendulum swing from left to right and back to center. What was true in 1960 became false in 2000, became true again in 2020. So in the new book, Ophthalmology, we talk about the journey of medicine and where we are today and how to embrace how to get to tomorrow.
Very good. I know we have covered a lot. I just wanted to ask you to please discuss how patients are able to find the services that you offer.
Great. So our services are offered on an individual basis. You can find us at our website, which is restorationhealth365.com. Our office here in Jericho. We do a fair amount of telemedicine as well. Now, in our telemedicine protocols, depending upon what is needed, we can send lab requests to anywhere in the country. The actual physical assessment would need to be done here in New York, but I can tell you we already have patients that have flown in for the day, and we can set that up and arrange that for our patients. Because again, what we do here at Restoration Health is not done on Main Street. It's not even done on the side street, and it should never be relegated to a back office. What we're doing here should become what doctors are doing everywhere, because our healthcare system currently is not designed to keep you healthy. It's designed to intervene when you're not healthy. What we want to do is drive healthcare into true health care, not health intervention. So very often I have patients under my care who go see their primary doctor. And I should state, being under our care, part of our contract requires you to have a primary care physician. Because we'll be honest, we are not primary care physicians. We are your wellness consultants. That being said, we have many patients that come back to us and say, my doctor said you're hurting me, or my doctor doesn't agree. That's fine. Your doctor doesn't do what I do. Your doctor doesn't understand what I do. You need to decide where you want to be. If you want to continue with your doctor, that's fine. But understand, I'm not going to fight your doctor. I am not going to challenge your doctor. I can provide you with the literature. You can bring it to your doctor. I'll tell you in our experience that your doctor will not read the literature I provide because of their confirmational bias. And so, if your doctor says, you have to stop the thyroid medicine, I'm going to stop the thyroid medicine. Or you can find a new doctor. But I'm not going to go head to head with your cardiologist or your primary care physician. I can tell you right now that almost every cardiologist puts their patients on a statin and an aspirin, men and women. I can also tell you that there has never been one single controlled study that shows benefit to women from the prevention of heart disease in women. So why are they all on it? Because it's what they do. I'm not going to fight your cardiologist, but I am going to step up to the plate for you. I'm happy to provide you with the information, the research that we use to take care of our patients. Whether your doctor subscribes to it or not is a choice. But we are here to take care of you. We are here to help you onto the wellness and to the longevity side of life. But again, we're not going to go toe-to-toe with your primary physician or your cardiologist.
I think another big topic that a lot of people are curious about is weight loss. If we have to talk about weight loss, I know that there's a lot of medications available in the market that are branded medications, but they're very expensive, and a lot of people don't know how to administer, and then there's always shortages. Talk to us a little bit about how can you offer weight loss treatment plans in your practice?
So weight loss is probably the single healthiest thing people can do next to stopping smoking. If we talk about the big drivers of disease and morbidity and mortality in this country, it's obesity and the results of cigarette smoking and alcohol abuse. All of those drive disease. Weight or obesity or being overweight is the single most important determinant of long-term health. When we go back to COVID, the biggest determinant of survival from a COVID infection was whether you were obese or not. And it doesn't come down to the actual weight. It comes down to what the obesity drives in the body. The obesity drives inflammation. So the medicines that have recently come out or been more available for weight loss are medicines we've been using for 25 years. You know them as GLP-1s. You may have heard of semaglutide or tirzepatide that go by the other branded names. These drugs are similar to naturally occurring peptides, which are proteins in the body that drive the metabolism. The specific ones we're talking about drive the body to burn fat. Why is that good? Well, when you reduce fat, and I'm not talking the subcutaneous fat under your skin, we're talking about the visceral fat, the stuff that wraps around your organs and drives disease. When you drive down visceral fat, you improve your health. Now, medicines like these need to be under the guidance of a physician because nothing acts in a vacuum. While the medicine will drive down your visceral fat, it will also burn muscle. And the last thing any menopausal woman wants to lose is lean muscle mass. Because when you lose muscle, you're going to lose bone integrity and bone density and end up with a broken hip. And so unsupervised use of this medicine is certainly something we don't recommend. Now, recently the FDA has come out with a position to try to make these medicines available direct to the population. Understand the politics behind this is that the big pharmacy wants that revenue. These medicines are great medicines, maybe medicine of the century right now, but they need to be done in a supervised fashion because unsupervised weight loss will almost always guarantee complications, serious complications. And so they should be under a physician's guidance. We get our GLP-1s through compounding pharmacies. And again, compounding pharmacy, the medicine is not FDA approved, but the pharmacies are under FDA regulation, what's called the United States Pharmacopoeia, the USP Act. And so very tight, rigid regulations to ensure quality. We get our medicines from these compounding pharmacies and we provide them directly to the patient, teach them how to use that, and we stay in touch with our patients weekly and monthly, and we guide our patients. And we have great success stories. I have 2 patients who came to me well over 400 pounds, whose idea of exercise was getting up and out of a chair. Both of my patients now walk their dogs around the block, down over 120 pounds. Could not do it any other way. And there are other options for weight loss besides the GLPs, which we can talk about at any time. It's not for everybody. It's for a lot of people. But there are other medicines that burn even fat even at a greater rate. Again, specific to what you need, not to what your neighbor needs or the population needs. But the GLPs, as far as a product to improve your health, probably the compound of the century right now.